who are uninsured, but we've got to find a way to protect those who are insured, to make sure that they have affordable insurance, and to make sure that insurance companies do not exploit those who are insured. And so we've been busy in Congress trying to make it happen. The President promised during his campaign that if elected president, that he would make it a top priority, that we would have fundamental health care reform in this country. And 1 week after President Obama was elected, he called us to the White House and he told us that it was time to begin health care reform. We could not wait another year to make it happen. And so he told us that his preferred methodology was to allow the Congress to come up with health insurance reform, and that he would not, as president, try to micromanage how we developed the plan. He felt that President Clinton had made a mistake in getting too much involved in the details of health care reform, and so he gave it to us to do it. And we worked very hard to get it passed. The House passed a bill, the Senate passed a bill. The two bills were different. And under the rules of Congress, in order for a matter to become law, they have to be the same. During the Christmas holidays, the President worked with congressional leaders and came up with a compromise on what it should be. And so finally, a few weeks ago, the one that you saw on television, we finally agreed to accept the Senate version with a few modifications. And so we passed the Senate version by a vote of 219 to 212 and sent it over to the President for his signature. But the bill that we passed, the Senate bill, had some shortcomings. It had some holes in it that we were not proud of, and we had to fix it. And so what we came to the conclusion we came to was that we would pass the Senate bill, but during the same legislative week, we would come back with some fixes or some modifications to the Senate bill, and that's what we did. And so now we have health care reform, and we are very proud of it. What this bill does, and I will give you this in conclusion, because I could talk for hours about this, but what this bill does that's very important to Edgecombe County, you need to know this. Right now, Medicaid is only available for families, for low-income families. We have relaxed the rules on Medicaid so that individuals can now qualify for Medicaid. We've never had that before. And so that 35-year-old minimum wage earner who's not married with no dependents, who previously didn't have insurance, can now get Medicaid. So any individual or family that makes less than 133% of poverty will qualify for Medicaid. That's a fundamental change that is good. For those families between $22,000 a year and $88,000 a year, we will help you, we will assist families and individuals in purchasing insurance. If you're at the low end of the spectrum, if you're at the $22,000 end, you will have to pay maybe 3% of your salary in order to get insurance, and the federal government will pay the rest. But it's a wonderful program. It is intended to help those middle-income Americans get the health insurance that they deserve. If you're over $88,000, then there will be no assistance at all for the individual. One thing that is very controversial about health care reform is the fact that we are mandating every American to have health insurance. That is a concept that is new to the way we administer health care in this country, but it's absolutely necessary that every American have health insurance, because you cannot wait, or you should not have to wait until you get sick in order to get health insurance. And so every American will be mandated to get health insurance, and if you cannot afford the health insurance, the federal government will help you purchase that insurance. We have a wonderful inclusion in the bill for federally qualified health centers, and you're sitting in one right now, one of the best in North Carolina. We are doubling our support for community health centers, and that is a good thing. We are also addressing the donut hole. Some of you know what it is, and some of you don't know. But right now, under Medicare Part D, the federal government will pay for medications for senior citizens up to about $2,200 per year. when the senior citizen gets beyond $2,200, 100% of drugs will have to be paid by the senior citizen. That is very unfair to our seniors. And so we have a 9-year plan to close the donut hole. It's very expensive, and so we had to do it in stages. But in the first year, we will give a $250 rebate to our senior citizens to help with prescription drugs. And starting next year, the major pharmaceutical companies in this country, the Pfizers, the GlaxoSmithKlines, the others, the name brand companies are going to give a 50% discount on prescription brand drugs. And hopefully by the year 2019, the donut hole will be completely removed. It is truly reform. We need for you to help us explain to the American people and to the people of Rocky Mount, Nash, and Edgecombe counties that health care reform is good for this community. We need to explain that all of us are going to be better off because of it. And so I want to thank you for supporting me. I want to thank you for supporting this health center because when the history of this era is written, it will be said that the health care reform decision was one of the best decisions that we've ever made, and it will be in line with what Roosevelt did with Social Security and what Lyndon Johnson did with Medicare and Medicaid. It is the right decision for the right time. Yes. So thank you for your friendship. Thank you for your love.
Thank you, Congressman. Shafia and our speakers that were speaking today, if you don't mind, and Dr. Marcel. If all of you would come forward, please. Yes, Shafia, please. Yes. She's a part of Black Workers for Justice, and they're part of the North Carolina Healthcare for America Now coalition. We want you to come forward at this time.
Lois,
and any other
Andre,
yeah. Anyone else?
Ms. Wilson, come up, please.
Really, I'd like to take a picture with all of y'all as we make this presentation. Because all of you deserve to be standing. But hopefully you're standing in spirit, you know, as we make this presentation. And I need to get my The reason why, you know, I really wanted everybody to come and surround the congressman is to know that with community, it's all of us working together. It's no one person by themselves or no one organization by themselves. It's all of us standing hand in hand to make change. And even as healthcare right now that has been passed, we still have a ways to go because there's still going to be some people that still won't be covered, and there's still additional things that have to happen. But if all of us stand together and work together and have Congressman Butterfield's back and make sure that you know that he gets what he needs as far as support from the community, it can happen. So today we want to give a certificate of appreciation to him, a thank you, and this certificate is awarded to Congressman G K Butterfield in recognition of making health care reform for all North Carolinians and our country a reality. Your vote for the people is saving lives, lowering costs, and insurance reform that will make health care a right, not a privilege for all. And we're saying thank you.
Thank you.
Stand right there. Stand right there. Let's take a picture. Yeah. Okay. All right.
Thank you very much.
Thank you.
All right. Appreciate you. Got a roll.
And I'd like to thank also OIC, you know, for hosting this, and to City Councilman Rubin, Blackwell. Thank you so much, and thank you for each one of you. And remember, all of us have to continue working together because we still have work to do.
That's right.